The human body is a masterpiece of nature's work. It is a stunning amalgamation of form and function. The bone marrow is one such incredible creation of our body. Bone marrow is the birthplace of the human immune system. Bone marrow creates blood cells which control vital functions like supplying oxygen to the tissues, preventing bleeding and managing defense of the body. When something goes wrong with the production of blood cells, it may lead to disorder like thalassemia and sickle cell anemia, which needs lifelong treatment. And in some patients, abnormalities in bone marrow leads to blood cancers like lymphoma, leukemia, multiple myeloma. Keeping pace with the technology, medical science has evolved to cope up with such deadly diseases and gifted society with the treatment called bone marrow transplant. The treatment requires a dedicated and comprehensive setup of international standards. Bone Marrow Transplant Unit. The Bone Marrow Transplant Unit at Sterling Cancer Hospital is equipped with ultra-modern infrastructure and widely experienced experts in the field. For successful procedures and avoiding complications, BMT unit follows stringent protocols right from the entrance of BMT room. To maintain an aseptic environment in the BMT unit, it follows the highest standards from cleaning hands to wearing OT clothes, masks and caps.
Bone marrow transplant is a procedure which does not require any surgery on donor or patient. Patient's unhealthy bone marrow is wiped out with the help of medication, and donor stem cells are infused intravenously just like a blood transfusion. These stem cells ultimately find out their own way to bone marrow, where they engraft, proliferate, and then recovery of patient occurs.
Post bone marrow transplant, the immune system is weak and WBC count are almost zero for 2 to 3 weeks. So the risk of infection will be really high. The patients are therefore kept in an isolated environment under positive pressure until the new bone marrow begins to work. The BMT rooms have all required facilities for patient comfort and effective treatment. To make BMT room completely infection-free, even the food meant for patients follow the highest hygienic protocols using UV treatment. To ensure biosafety for the patient, BMT unit is also equipped with biosafety cabinet. The purpose of the biosafety room is to prepare required medication for patients in a sterile way.
Bone marrow transplant can be curative for many non-cancerous disorders like thalassemia, sickle cell disease, or inborn bone marrow disorders. It is also curative for those blood cancer patients who do not respond to routine chemotherapy. We at Sterling Hospital offering bone marrow transplant treatment since 2011. Our first patient of bone marrow transplant, who was a case of high-risk blood cancer, had undergone allogenic bone marrow transplant in 2011, and now he is back to his routine, enjoying his happy, healthy life. Our center is now well equipped with the trained manpower and state-of-the-art infrastructure, where we can cater even those patients who do not have 100% matched donor. I am sure this BMT unit with cutting-edge technology will cater Central and South Gujarat, ensuring best patient care of international standard.
The BMT unit at Sterling Cancer Hospital is committed to treat the patients with benign and malignant diseases of the blood and related blood disorders in both adults and children with the best of treatment and care.